Well, currently I'm a clinical psychologist and I work in community mental health. And so a lot of the people that I see are either directly involved or indirectly affected by the opioid crisis. I work with a lot of children and teenagers, and a lot of them come from homes that have been broken in some way because of the opioid crisis.
We see a lot of people who are not all that well, who don't fit all that well into the traditional recovery model. Some who are not. The 12-step models have helped people for a long time, but we see a lot of people with opioid use disorder. Medication-assisted recovery seems to be very effective with those people, and they don't always feel completely welcome within the 12-step community, which is an abstinence-based community. So we are seeing a need for recovery mutual aid groups that are different. We're seeing the effect on families. We're also seeing a lot of grandparents now who are raising their grandchildren because either their children are incarcerated, or they've lost custody due to use, or they're still struggling with trying to find a way to recovery.
So I'm with the United Way of Porter County, and we have this United Against Opiate Abuse initiative and trying to set up a regional response. A lot of what I've seen is that a lot of communities might have resources, but everything is so localized right now that there isn't a lot of cross-collaboration across counties. There's so many different treatment options, but people need the right treatment option for there, and they need to A, find it, and B, need to know how to get there, and that transportation is a huge barrier that I've found.
One of the main things that we see is the increase in communities of color of overdoses. It's been slow to hit minority communities, but it certainly is here now, and the numbers are on the rise in the African American community.
We are headed into yet another version of the war on drugs by creating policy that creates stiffer jail sentences for drug offenders and drug users, and it's just yielded no response. And so we, yet again, don't get to the real issue, which is addictions. Who is being affected by this? Of course, folks who suffer from addictions, from the misuse issue, but folks who don't have addictions in their medical history or have never been a user or are not in recovery when they have legitimate chronic pain issues. Now we're creating a phenomenon where those people can't get their pain managed. And so I think what we are slowly doing, people are looking for alternative ways to manage their pain that are always not legal. So we're slowly but surely creating this whole street drug culture.
I've seen, the data. I've seen, these numbers grow over the last few years as far as overdose deaths. Talk to families, talk to law enforcement, talk to treatment professionals. I've pretty much seen every side of it. Just recently we started to see some of the overdose death numbers at least go down a little bit. So perhaps some of this focus on this crisis is starting to work.
We are seeing death, we're seeing destruction, we're seeing changing of lives, not only through young adults, teenagers, but also adults. It's become a major problem, a major crisis, and we have to try to do something about it because I don't see it getting any better. I see it continuing to get worse.
At 24 was suicidal. Addiction was completely out of control. Found myself in a situation where I was in a hotel room by myself doing drugs and planning to kill myself. And luckily, I couldn't do it. Every time I thought I was ready to do it, I thought of my parents and what it would do to them and things like that. And so ultimately, after a couple days of that, I crawled home, told my parents what was going on, that I was just beat. And I ended up in a locked psychiatric facility, dual diagnosis for 28 days at 24 years of age. And for some reason, I've been lucky, and that was my bottom. My sister ended up going in for treatment about 6 months after me. She realized she had a problem as well. But yeah, it was there's a family history there, but I think that's part of it. Is it's hard to look at your kid, and a lot of times I was doing the same things to drinking and stuff that others were, and they just kind of chose to ignore it and think it was a phase, and they were functioning, so they thought I would, but I had reached a stage where I was no longer functioning.
I see both sides of it a lot. What I see with clients that I have is a lot of them are really, really young. I have one as young as 14 years old right now. It is becoming a lot younger, like other people have mentioned, and the problem with it is it's becoming, the drugs in particular are becoming much more powerful and much more tampered with. They are mixed with things such as fentanyl and just other components that make it so much stronger and more likely to overdose.
It is so diverse. This disease and addiction and substance use disorder and opioid use disorder, there's not a face, there's not a typical person. We've had from a guy that is, like I said, 79 years old, Caucasian male, to a 18-year-old African-American female. I mean, we see the full, it doesn't discriminate against age, gender, occupation. We see tons of different people, and there's not really one type of demographic that we serve. We're very open to everybody that's going through this.
I work in a nonprofit retirement community, independent living, where our average age is 87. We're seeing many of our residents that have prescriptions from multiple physicians, different types of opioids. In many cases, they are unaware that they have an opioid. They're so used to referring to the name of painkiller or narcotic. There was a bill recently signed that passed the House and the Senate in Indiana, and prescription labels now will also say opioid in addition to the name of the medication. We should see that later in 2019. Pharmacists are aware, and when we do education in the community, we talk about 10 things that you should speak with your practitioner and or your pharmacist about. Always keeping your list of medications with you, asking specifically what the medication is for, when should I take it, why am I taking it, how long should I take it. Very important things for you to know. We know physicians' offices are very busy, and if you don't take it upon yourself to advocate and ask those questions, you may come away with very little information.
We have a lot of people coming through, people coming from Chicago to Chicago. We're seeing a lot of people who leave town to either buy drugs, get high, engage in those types of activities, and then they wind up back in town, maybe with the drugs or overdosing. We run the gamut. You see people who have had a sports injury, gotten addicted to pills. People who were addicted to pills, and doctors, they're really hammering down on prescribing. So they're not getting their pills anymore. Well, what happens next? Maybe people will self-medicate with marijuana. Sometimes people will turn to heroin. I mean, that's kind of, it seems extreme, but I don't think anybody ever starts doing drugs and says, boy, I really can't wait till I'm a heroin addict. It happens. So there's a progression. You see pill use in younger and younger, I say kids, because teenagers. And I think we're in an interesting time because marijuana is being legalized all around us too. So, it's legal here, it's not legal there. Is it right? Is it wrong? It's hard, it's difficult. It's a mindset that people don't grasp. And I think young kids don't truly understand the long-term ramifications of not just marijuana, but just drugs in general, because everything is so sensationalized. It's great to be high, it's great to smoke pot, it's great to do this. The education piece, it really needs to be there, and I feel like we're lacking in that area.
What we're currently seeing is our citizens are going over to Chicago, Southside Chicago, buying and using on the way back. And then by the time they get back here, we have our overdoses, or they buy and they bring it back, and then we have our overdoses. We're not seeing the sales locally.
Well, as a police officer, we see, unfortunately, overdoses. There may be some times where you see somebody that you stop that might have an illegal substance on them, whether it be heroin or something like that, and then they may get arrested, but most of the time we're coming across people who are dying because of opiate addiction and overdoses. we recognize the addresses and we recognize the names of people in our town. When that call comes out, it's always kind of, here we go again. It's, this person again, and it doesn't stop us from acting any differently to try to prevent them from dying using Narcan and everything like that. But that address pops up on our screen, or we're dispatched to it, and you just kind of know.
From a paramedic perspective, obviously we get calls like this quite a bit, normally in the form of overdoses or unresponsive individuals. We respond to individuals' homes, we see them in their homes, we see them with their families. So not only do we see an individual that we have to physically take care of, but we also experience the crushing impact on the family that's around them. Sometimes we see their children whenever they're overdosing. Sometimes we see loved ones and parents, and it's their child who's sitting there overdosing. And we have to deal with that as well.
Anytime I have a classroom full of 20, 30 people, if I ask, how many of you have been affected by drug addiction, almost every hand in the room goes up. It's that common. The trainings have different now versus 19 years ago. In the last year, we had a firefighter on a scene of an overdose, and he was exposed. In that instance, it was actually fentanyl. They left the scene. They were just there assisting. They left the scene. He was driving the engine, said, "Hey, I don't feel well." Stopped, got out, and dropped to the ground and was breathing about 4 times a minute. Had overdosed just from exposure. And then there was a example of a nurse in the ER who, again, was dealing with someone and came into contact with a substance and overdosed as well. And both of those people, fortunately, they ended up being fine, but they did rounds in the ICU to make sure that the substance was out of their body. But the strength, the potency of the things that we're coming across now, the heroin, it is what it is. Although they say that the strength, the purity of it is stronger now than it ever has been. And then some of these the fentanyl, the carfentanil, there's a nickname for one where it's a mixture of drugs called Gray Death. And it literally got the name Gray Death because that's how the patients present. When you walk in, they look dead. They're gray as opposed to my beautiful Irish red skin. And what we have found is that we've had to change how we respond. So now we found that there are gloves that we have always used that actually are not protecting us the way that we thought they did, and so we have to get special gloves. The other PPE that we wear, we've had to increase the amount. So you'll see first responders coming in, and now not only are they wearing the special gloves, they're wearing eye shields and face masks and all of that. And it goes across all of public safety. There are tons of stories of cops being exposed as well. If anything, they're probably even more at risk because in the process of patting down patients and finding things, it increases their risk of being contaminated.
I really feel like our county is seeing everything. From heroin to fentanyl to pills, powders, liquids, cocaine, meth. I mean, unfortunately, we have a little bit of everything. We recently had one of our detectives come across a lavender powder. It smelled very, very strong, and that ended up being fentanyl. And I think the best thing that I've learned is whenever I'm searching a car these days or checking somebody's pockets to glove up immediately. Stopped a car, and the passenger was lying about who he was, and his cigarette package was a white powder with a straw. And for years I've arrested people that was always cocaine. And this gentleman's warrant was for cocaine. So when I asked him, well, what's that white powder? And he says cocaine, I did believe him. I did already have gloves on, thankfully. It later came back that it was heroin and fentanyl. When I saw him at a gas station a few weeks later and he was out, and I came up to him and I said his name. I said, hey, just just so you know, that was heroin and fentanyl, that's very, very dangerous. And he seemed surprised, and I think that's, maybe sometimes people always know what they're buying, but I don't think they do all the time now. And it's just like with police and fire and EMS, anytime we're coming into contact at a overdose, at car stops, anything, you gotta protect yourself, because it's out of control. There was a detective recently stopped a car on the toll road. The pills looked like they were OxyContin. After testing them, they were fentanyl pills, and had he just looked down and, they got the imprints of, or whatever it is, Xanax bars, any type of, hydrocodone, Viagra, whatever it is. Whatever you think it is, it may not be that, unfortunately, and that's what we're seeing.
The big calls that I've gone to were one actually in Hebron, Indiana. When I had gotten there, father had said that he had found her in the shed. He had said he had seen her probably about a week prior. And then he said that she had checked herself into a rehabilitation center, come to find out that she had checked out that same day. Parents didn't know. It was most likely the first night that she was back, she ended up in her family's shed. And that's when she had fatally overdosed. She was slumped over on a riding lawnmower. And just based off of the time that she had been there, the mice had actually started eating her fingers. There was bone. We had found a needle and different paraphernalia stuck to her pajama pants later on when we had moved her body. Another fatal that I had dealt with was a father who worked with his son. His son had gone to bed probably around 9 or 10 o'clock. The next morning, he went to go wake up his son, saying, "Hey, we have the job to do." Noticed that the door was locked. He knocked, didn't get an answer. He had opened the door and found his son in a tucked, kneeling position on the floor, with his head on the ground, and by that point he was purple. You could see all the paraphernalia around the room, all the signs to tell the parents that if you would have done a little digging into your child's life, just taking a peek inside of his room, you would have known that he's addicted to narcotics or opioids. Those are probably the ones that stick with you the most, are the fatal overdoses. Responding to recent overdoses where someone survives, those are more life-altering for the patient itself, more of, I almost died, I probably need to get help. The fatals, they don't have that choice. The families have to deal with that.
When I first took over the coroner's office back in 2011, started seeing a steady rise of opioid-related deaths, specifically heroin. That seems to be the drug that's really caused the most devastation in our community over the past few years. What used to be something like, I think in 2011 was about 12 heroin-related deaths. In 2017, at the end of the year, we had 32 heroin-related deaths. So it's steadily climbed up. It's gone pretty much unchecked for all those years. You're starting to see a lot more of it in the public media right now. Another thing that we're starting to see is a rise of drugs such as fentanyl, which we all know heroin's a very powerful drug and easily used to overdose with, but fentanyl is about 80 times stronger than heroin. And actually, at the end of 2018, one of my last cases that I took care of when I was in the coroner's office, we had a carfentanil death. So we know that heroin's a very powerful drug. We know fentanyl's a much powerful drug, but then you have carfentanil, which is about 1,000 times more potent than heroin is. So it's something to really kind of watch out for in this community. Ohio's been bombarded with carfentanil deaths. They've had hundreds of carfentanil deaths. So it's just starting to make its way into Porter County. For the most part, what we have seen is that if you want heroin, they don't want to sell it here in Porter County because of our prosecutor's office, our sheriff's office, all the law enforcement offices that we have in place here. We treat it as a very serious crime here in Porter County. So what happens is everybody that wants heroin ends up going up to Chicago, gets the heroin, and brings it back here to use in Porter County. The worst part of the job is going up to the doors of parents in the middle of the night, knocking on those doors and explaining to parents that their child's overdosed and they're never going to get to see him again. And for the most part, it's always kind of the same reaction where the parents just kind of crumble down and they're crying on the ground. But then you also have those other times where, you know, you pull up in the van, the mom opens up the door and she sees the van out there and she's calm and collected and says, "I've been waiting for this day for a long time. I'm just kind of glad that it's over with now and I don't have to wonder what day it's going to be." Those are always kind of surreal type moments to have a parent actually say that, but you have to realize that they've been through probably years of dealing with a lot of different problems in that relationship and watching their son or daughter struggle with addiction. And it's a very devastating disease, not only for the individual, but for the family as well. And as much as you want to help somebody that's got an addiction problem, it's really tough to actually provide them with the help that they need.